Donning sterile gown and close gloving. The nurse must wear a sterile gown in the operating room so sterile objects can be comfortably handled with less risk of contamination. A gown is applied after surgical hand scrubbing and after the nurse has donned a mask and a surgical cap. The purposes are to provide a barrier between microorganisms in the nurse's uniform and the client, maintain a microbe-free covering over the nurse's uniform, and to prevent a nosocomial infection associated with an invasive procedure. The materials needed are sterile gloves, mask, surgical cap or bonnet, and sterile gown. Implementation. Inspect the autoclaving tape used to secure the gown. Note that it confirms the sterility of the contents. Don mask and cap. Carry out surgical hand scrubbing for at least 5 minutes each hand. Pick up a gown, grasping inside surface at the collar. Hands are not completely sterile. Inside surface of gown will contact clothes and skin surface so it is considered contaminated. Stand away from the sterile pack and table. Hold gown at arm's length away from your body to allow the gown to unfold by itself. Be careful not to allow gown to touch the floor or any non-sterile fields. Hold gown by inside, open shoulder seams and insert each hand through armholes. Keeping your upper arms in front of you at your shoulder height, extend hands toward gown cuff, do not push hand through cuffs. Having a circulating nurse to assist by reaching inner side of the gown and pulling inner shoulder and side seams onto your shoulders. Because working from behind scrub nurse prevents contamination by circulating nurse, gown should fit comfortably. Closed gloving. With your hands still inside the gown, open the sterile inner wrapper of the glove on the sterile field. This is to prevent contamination of the sterile gloves. With your dominant sleeved hand, grasp the cup of the gloves for the non-dominant hand and lay it on the extended non-dominant forearm with palm up. Place the palm of the glove against the sleeved palm with fingers of the glove facing towards the elbow. Manipulate the glove so that the sleeved thumb of the non-dominant hand is grasping the cuff. With your dominant hand, working through its sleeve, grasp the upper side of the glove's cuff and stretches the cuff over the end of the cuff of the gown. With sleeved dominant hand, grasp the cuff of the glove and the gown sleeve of the non-dominant hand. Slowly extend the fingers into the gloves, making sure the cuff of the glove remains above the cuff of the gown sleeve. With glove non-dominant hand, puts the glove on the dominant hand by repeating the procedure done. To maintain a aseptic technique in donning gloves on the dominant hand. Adjust fit and remove wrinkles of the gloves.